Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 6.
Finding a physician should be like speed dating. If you don't like the person, don't go see that person again. Probably many patients have had this experience where they feel like they're dealing with the doctor God, right? They're on a high pedestal and they're telling you what you need to do. And if you don't do it, then you're fired. Well, I think it's the other way around. You decide, you're in charge.
Well, I'm very excited to have back to the show, third time's a charm, Dr. Megan Saunders. Thank you so much for coming back to the show.
I'm happy to be here. Thank you, Ashley.
I had a lot more questions to ask after the last 2 times you were here. I know last time you were here, we focused mainly on sleep, which I am sleeping a lot better now. Thank you very much. And I hope our listeners are too. I think you gave us a lot of great sleep advice and helped us create sleep hygiene.
Well, I'm glad to hear that.
And so, you brought up a lot of great points, and I wanted to focus in on some medical myth busting today. Our listeners, they want to be on the cutting edge of holistic health science. And today, you can set the record straight by busting a medical myth. What is a health myth that you can help our listeners understand? Like, for example, aluminum doesn't really cause Alzheimer's, and eating eggs is actually good for you.
Sure, yeah. I'd like to answer that by telling you a story about a patient that I had of mine. And so patient who's come in, she's very concerned about cardiovascular disease and a lot of anxiety about it. She was just told by her medical doctor that her cholesterol is high, and so she needs to be taking a statin drug. And to the point that she's having difficulty sleeping at night because she's so concerned that she's going to die of a heart attack. Now, she recently retired, was very much looking forward to spending time with her grandchildren and traveling and the golden age, right? And now she's worried she's going to die. And so she comes into my office. She's a new patient, and she tells me this story, and I look at her cholesterol. And so there are a couple things about her cholesterol that were notable. One, her HDL, right, the good cholesterol was quite high, and so that made her total cholesterol very high. And so if you were just looking at the numbers of total cholesterol, then you might say, yeah, you have hypercholesterol. But part of it was because her HDL, the good cholesterol, was so good because she had such a good diet, good exercise. And the other reason is, there's the good cholesterol and what people like to call is the bad cholesterol. And it's not that LDL cholesterol is bad. Your body needs cholesterol. It's an important hormonal precursor. Your nerves need it. Your body needs cholesterol. It's not making this useless product. That there's a reason for it. And so the reason that people get concerned about the LDL cholesterol is because it's more easily oxidized. So really, when I see people for cholesterol concerns, I'm looking more at things like their blood sugar. What's going on? What are things that are going to be causing oxidative damage? Things like eating rancid oils, things that are going to cause that cholesterol to become oxidized and cause damage in that way. So she was told by her medical doctor that to essentially save her life and prevent cardiovascular disease, she needed to take a statin drug. And so I think that's a major myth that we continue to find more and more negative side effects of taking statin medications. Now, there's issues. One of the reasons that people take statin drugs is because what it does is it prevents the production of cholesterol by blocking the HMG-CoA reductase enzyme. And so what that enzyme also does is makes CoQ10. Now, CoQ10 is a very important cofactor in your body for the mitochondria in terms of making energy. That's what mitochondria do, is they're the engine of your cells. And so to be able to convert glucose and make energy, your mitochondria needs CoQ10 as one of the important cofactors in that process. Now, the heart uses a lot of CoQ10, and so if you're blocking the production of CoQ10 to prevent cardiovascular disease, but then you're blocking this very important nutrient that your heart needs, that you're increasing risk factors for cardiovascular disease and also increasing risk factors for Alzheimer's. That's a known black box warning for statin drugs, is this association with increased risk of Alzheimer's, as well as muscle weakness. Especially elderly people tend to get put on statin drugs a lot, and they're at high risk for falls. So is this person going to be more likely to die of a cardiovascular event versus trying to get trying to get cholesterol in this very narrow range of what people have said now is the ideal cholesterol, which if you look at the ranges, it's become narrower and narrower with the advent of these cholesterol blocking drugs. And so the ranges used to be much broader and much more comfortable, and we haven't seen a decrease in cardiovascular disease with the use of statin drugs. And so the risk for the elderly person taking this is they're more likely to die from falling because of these muscle weakness that can occur with blocking CoQ10 and fracturing a hip. There's a much higher risk of comorbidity with that than there would be from having higher levels of cholesterol. And actually people who have higher levels of cholesterol that make it into their 80s and 90s actually have much higher outcomes in terms of mental alertness, less incidence of Alzheimer's, and overall quality of life factors. So I think that the medical myth that I'd like to bust is statin drugs are not going to save your life, and there are better ways to improve your health through natural means, through diet and lifestyle means, and that cholesterol isn't the answer. It's like calling fire trucks the problem when there's a fire. When people get atherosclerosis and buildups of plaques in the cardiovascular system, the problem isn't the cholesterol. The problem is, why is the cholesterol collecting there? And that's because of oxidative damage to the cardiovascular system and the body's innate wisdom. It's putting these bandages down because it's going to block you from bleeding out through a damaged artery to cover that area. Now, the problem is then it continues to build up if we don't address the underlying cause. So underlying cause is healthy diet and lifestyle. And that's what we do in naturopathic medicine, is counsel people, and also to not be so concerned about these numbers that are slightly arbitrary. For this person, she was so concerned about her total cholesterol. Her LDL cholesterol was slightly elevated for the very narrow ranges that exist. And so I was quite comfortable with where her cholesterol was at. Her HDL cholesterol was excellent, so that's what made her have the total cholesterol, right? LDL plus HDL equals your total cholesterol. And so she was actually at quite low risk for cardiovascular disease. Now, her blood sugar was starting to get high. Her fasting blood sugar, she wasn't diabetic, but her fasting blood sugar was around maybe 102, 104, I forget exactly what, but that's what I worked on with her. And through that counseling, she was able to sleep. She had less stress. She made the lifestyle choices that she needed to get more out of her life. So she was exercising more. She had more energy. Her mood improved because of that. She eliminated her sugar addiction, and she was able to get what she wanted from her retirement without taking a drug that has a lot of known side effects.
Now, I love how you described your time with your patient, because it really sounded like you took the time like an investigator to look at, okay, well, here's her concerns. Let's look at the evidence, and now let's look at what we can really do to make the biggest impact in terms of her health. And that's something that you just the average visit to an MD, you're not going to get that kind of one-on-one time that you do with a naturopathic physician. So I love that. I love that story. Now, for people who are worried about their cholesterol, or more to the point, are worried about having a heart attack or having a stroke or having some kind of cardiovascular event, and you had mentioned diet and exercise play a role in maintaining that health or achieving that health. What specifically can we do to, like, let's say someone has plaque in their arteries or in their heart, what can they do to reverse that or prevent it?
Yeah, so that's a really complex question, and for a lot of people, we need to look at some of the underlying factors that led to the cardiovascular disease, or the risk factors for that. So we look at inflammatory markers, number one. So we look at the blood and we look at their CRP or their HSCRP, the high sensitivity CRP, which is going to tell you is there specific inflammation that is present, oftentimes associated with cardiovascular disease, but can also be there with other disease states. We're going to look at their sedimentation rate or their ESR, which is another inflammatory marker, and get an idea, is this something that's contributing to this oxidative damage, this inflammation that's going on in the heart. We're also going to be looking at things like blood pressure, right? If the blood pressure is very high because of chronic stress, and so simply the pressure is causing damage to the cardiovascular system, to the kidneys, as well, then that's something that we need to address. In terms of diet, you have to make sure that what's going in is going to be nutritive to the body, that you're having an antioxidant diet and an anti-inflammatory diet. So making sure that you're getting plenty of your omega oils, especially your omega-3s, that you're getting all of the cofactors that your body needs to support healthy blood pressure, cardiovascular health, things like magnesium and calcium, your B vitamins. There's kind of, it's a very complex question, and for some people, some of those issues are also related to things that we look at, like one of the kind of popular things that are going on right now in naturopathic medicine is focusing on this genetic change called the MTHFR gene, or the methylated tetrahydrofolic acid. And what that is a gene that codes for an enzyme that allows you to activate folic acid. And there are several different changes that can occur with it. One of the changes that can occur with it increases risk of cardiovascular disease because it prevents the body's ability to complete the methylation process, and what you see is higher levels of homocysteine, which is a marker or a red flag for cardiovascular disease. So sometimes we apply medical nutrition and add in supplementation to target these specific changes by adding things like methylated folic acid, if that's a concern. But it's a very complex question, and I like to target things individually to a person's medical history, their personal medical history, their family medical history, and finding out where they're at. It's a very different situation of a patient that comes in that is exercising 5 days a week, 30 to 90 minutes a day, and is meditating, their blood pressure is good, their cholesterol is good, but they still have these inflammatory markers, or they're whatever, there's still something going on. Then that's a higher level of concern of an organic, sort of, by organic, I mean something that's going on in the body, a physical thing like kidney disease, that is going to be less supported by some of these lifestyle interventions and needs a higher level of assessment and intervention, versus the person who comes in that has little to no exercise, is eating a very high carbohydrate, high fried fat sort of food, getting lots of chemicals in their food, and then there's a lot more to work with and a lot more different level of assessment and intervention.
So as complex as it is, there sounds like there's a lot of hope. I mean, if you go to a medical doctor and you have plaque, what they're going to do is put you on drugs.
Right.
And they might say, yeah, there's research suggesting that diet and exercise play a role in it, but they don't have training. Like, medical doctors do not have training in nutrition unless they go after medical school and they go take extracurricular courses, whereas naturopathic physicians, that's their bread and butter, is understanding how nutrition plays a role in health.
Our gluten-free bread and organic grass-fed butter.
Yeah, right. Exactly. And so, what it sounds like for those who have that concern, or maybe you have if you have a history, your grandfather and your dad and your uncle all had heart attacks, this is something to give you hope that you can go to a naturopathic physician and you can learn what tweaks you can make in your diet and in your supplement protocol and in your lifestyle, that you can actually reverse and prevent having the same fate that your relatives did.
Right, yeah, and also it's important to be able to assess with the family history as well, getting an idea of what level of alarm bell we're at. So if we're just looking at cholesterol and it's someone who has no family history of cardiovascular disease, I'm very comfortable doing diet and lifestyle, and really looking at their overall health markers. And there are a lot of times that I don't get terribly worried about cholesterol. It's certainly, like I said, I often focus a lot more on blood sugar regulation and cardiovascular markers in other ways, like the inflammatory markers that I was talking about. If someone has a strong history of cardiovascular disease associated with atherosclerosis, then oftentimes I'll want to do further assessment to see, is this something that this patient is actually dealing with now, like getting a carotid ultrasound so I can see, is there what stage are we at here right now? How strong of an intervention do we need to make to change this plaque buildup at this point? Is it just that cholesterol's high and there's a strong family history, so we're worried this might happen? Or is it that it's already happening now and we need to really go full guns out to be able to improve this person's cardiovascular health because we're more worried about an event happening, or if they've already had cardiovascular events? Now, lots of times those interventions are going to be similar, but perhaps the level of tracking that I'm going to be doing is going to be different to make sure that what we're doing is working.
I actually really like that idea to go for the carotid ultrasound, because that really does help you with some peace of mind. Like, okay, where are we actually at? So, if you're worried about having a heart attack or worried that you have plaque, that is a easy way to sort of assess the situation. Mm-hmm. And I actually really like that. There was a concern my husband had that showed up in his blood work, the same markers you're describing, and he had that test a year or 2 or 3 ago. It showed up completely clean, and that was really promising.
Yeah.
We were worried about it, and knowing that it came out completely clean, we continued to clean up our diet and go down the path of being healthy, but we knew that it wasn't an immediate concern. Okay, so we talked about statins. Mm-hmm. Obviously, one of the drugs you wish no one would ever go on. What is another drug that you think that no one should take, and what is the natural way that they can, or a natural remedy that would be more effective?
So in general, I see a lot of patients that deal with chronic pain. And oftentimes I'm shocked when people come in and they've been prescribed a high dose of an NSAID, like 600 milligrams of ibuprofen every day, and they've been on it for the past 12 months. Even to the point with the savvy patients that know that risk factors for chronic NSAID use are kidney disease, liver disease, ulcers, that they've asked their medical doctors that, and the medical doctor said, well, it's this or pain. And so they're given, it's which bad consequence do you want to live with? And while, I certainly am not the type to chastise people for their decisions. If you have a bad headache and you're going to take an ibuprofen once, I'm not going to yell at my patients for doing that. But my concern is that people understand the consequences of their actions. And if you've got a bad headache every day, and you're taking ibuprofen every day, that's very problematic and is going to lead to long-term health consequences, such as a patient that I've seen recently who is relatively young and is borderline kidney failure. And we're trying to figure out, there's no family history of it, we're trying to figure out what the cause might be. And this is the big suspicion, is this chronic NSAID use that this patient had been on for probably about 7 years. And so I think people just don't understand that there are better options. Now, when I get a headache, what I do is I take absorbable forms of turmeric. If you're going to eat powdered turmeric, which raw would probably not be very appetizing unless it's mixed in with a lot of good curry, it's very anti-inflammatory and can have an acute effect on the body. So it can oftentimes knock a headache down quite quickly. And I have people for chronic pain take that as well. Now, sometimes it's not just inflammation that's causing pain. And so that's where I always ask a patient if they come in for pain. I say, have you taken anything like over-the-counter NSAIDs, and did that help? Because if it did, that is also helpful in diagnosis. That tells me, okay, there's an inflammatory component to this. So my natural inflammatory interventions are going to be helpful. Inflammatory diet long-term is going to be helpful. Fish oil long-term is going to be helpful. Short-term, working on that quick-acting turmeric is going to be helpful with the curcumin, which is the active constituent in there that helps with that. All these things can be helpful. If they tell me no, it didn't, then I'm thinking that maybe it's not inflammatory. That's the problem. That's necessarily the underlying cause. And so what I'd like to be able to see is people to know that there are other options, and also to know that pain is your body telling you something. It's a message. And if we simply suppress those symptoms, it's going to show up in other ways. And if you suppress it in a way that has other side effects, then you've got the original problem, and now we've added on multiple layers. So, no one wants to have chronic migraines and then also develop an ulcer. So that's that's something that I wish that people knew that they had other options for, to be able to reach for. And I always encourage my patients to do that instead. And then I tell them, if it didn't go away, if whatever, you were in a car accident and we're doing this anti-inflammatory protocol, we're doing a lot of physical medicine, we're doing our chiropractic and massage and PT and trigger point injections, but whatever, if the supplements aren't working, you're in acute pain, you can't sleep, the turmeric is helpful for the liver. It's anti-inflammatory for the liver, anti-inflammatory for the kidneys. If you have to take an ibuprofen on top of that, maybe we're breaking even. Probably not breaking even, but at least you've got something on board that's going to be counterbalancing the negative side effects of that. And there's also things like white willow bark, which is what aspirin is derived from, the active constituent from that. And so there's a lot of other options and formulations and things that we can do to help people with pain. And so that's what I like to do.
I love that answer. I actually tried that once after you had told me that you'd come back from a conference where you had met, I don't know if it was the rep that sells the curcumin.
Right, yeah.
And you're like, I have a headache. Do you have any more curcumin on you? And he's like, no, I just ran out. And you're like, why did you run out? And
he gave me his personal supply. He ran out to his car and gave me 2 from his personal stash.
Sometime after that, I had a headache, and I took the curcumin, and my headache went away.
Yeah.
And I thought that was so cool. It's like we could be just mowing down on turmeric.
I had a patient who was an engineer, and I told him to try this. And so he's very skeptical of some of these natural medicine interventions, and he's very science-based and structural, right? He's an engineer. He's a numbers guy. And I said, okay, take 2 of these, rate your pain on a scale of 1 to 10, and then set an alarm on your phone in about 30 to 45 minutes and check it again. And am I allowed to swear on this show?
The PBS version of it.
Okay, so he used an expletive, but he said, sure as something or other. It worked. 45 minutes later, his pain was, I forget if it was either gone or it was negligible. It was very much. So he was quite surprised, and I was pleased to have that trial of one, that N of 1 study for this intervention. So
Love it. I love it. So we should all stock our medicine cabinet with well-absorbed curcumin.
Yeah, not only that, but I love turmeric. It's an amazing herb. I use it for a lot of different things. I had a patient quite a while ago now who was dealing with rheumatoid arthritis and a lot of negative side effects from being on methotrexate, and working with her rheumatologist and a really wonderful rheumatologist. I loved working with him, very open to natural medicine. We worked together hand in hand to kind of make sure that as we're decreasing her methotrexate, that the other things that we're concerned about for her, including kidney disease and cardiovascular disease, that those markers are being tracked. And so a very good collaborative, integrative care partnership. I was able to get her down to almost no methotrexate. I think she was doing a very small dose once a week, taking high doses of turmeric and fish oil. Those were her only 2 interventions. I tried for the life of me to convince her to go gluten-free because of the high association of rheumatoid arthritis and gluten intolerance and that effect on the immune system. She would not do it, but she still got these amazing results just by using the herbs.
Wow.
And so the herbs and the fish oil. And so and I knew that because I was tracking her inflammatory markers. I was tracking her high sensitivity CRP, and it went down from quite high alarm ranges to completely within the normal range.
That's fantastic. And so did her pain go away 100%, or was it?
Yeah, so it was a comprehensive care plan for this patient of doing the anti-inflammatory approaches. She did do some dietary changes. She didn't go gluten-free, but she did do a few dietary changes in terms of a whole foods anti-inflammatory diet. And also doing massage therapy. I prescribed massage therapy for her, and that significantly improved her pain as well. Doing the compression around the joints, increasing circulation, reducing her stress. All of these things really helped a lot in terms of her mobility. So she went from not being able to walk around the block very well to, with the massage, the anti-inflammatory interventions, really being able to be quite active and not. She had said to me at one point that if she didn't have to take the methotrexate once a week, she wouldn't even know that she had any disease based off of her symptoms. So maybe I'll get her to go gluten-free one day and we'll get her off the methotrexate too.
I hope so.
Yeah.
That's very cool. So speaking of something really great we could have in our medicine cabinet to replace pharmaceuticals, what else would you suggest that we have in our medicine cabinet or like in our natural first aid kit?
Yeah, so to kind of build that, things to think about are common complaints. So first one would be first sign of an illness, right? The common cold. And so everyone, especially anyone with children, should have a nice elderberry extract or source of elderberry, whether it's, there are lots of good companies that put together a chewable elderberry. There's I Love, the glycerites, which is a type of extraction, of liquid extraction, because you can take a good dose of that. You can't get too much elderberry. My mother-in-law makes jams out of it, so it's a food, but it's also antiviral, it's antioxidant. It's great for the cardiovascular system as well because it's one of those dark berries, so it's got the anthocyanidins in it, which is a good cardiovascular antioxidant. But the antiviral component, at the first sign of illness, really high dosing that. So at my house, when we start to get sick, we've got a nice elderberry glycerite that we harvested it ourselves. Not everyone can do that, but it's so easy to find good elderberry on the market. So we harvested it. We've got it in a big bottle at home, and we take it by the tablespoon doses, every hour, every 2 hours. So that's amazing. There are lots of different products that you can do as well on top of that. So echinacea, you can mix it with some echinacea, also very important to support the immune system. So then you have the antiviral component, but then you also have the echinacea, which is going to be stimulating to the immune system. So you have the one thing that's knocking down the viral load with the antiviral part, and then the immune boosting part, so that your own sort of arsenal is ready to handle either whether it's bacterial or viral. So both of those on board, both of those safe for kids. So that's probably number one to have in the first aid kit. Then, another common complaint for folks is going to be any sort of digestive complaints. And the easiest home remedy for things like diarrhea, right? You go out, you got a GI bug, or maybe you ate some food that was perhaps a day or two past what it should have been. Your body's doing something very helpful by flushing that through, but sometimes we want to make it livable at the same time. And so cinnamon is an amazing herb for that. And that's just something that you have for cooking, right? And so mixing cinnamon with some raw honey, which is going to be antimicrobial as well, and probably about a teaspoon of cinnamon with a teaspoon of honey, so like a 1-to-1 ratio. It's very styptic. Styptic means that's very drying. It tightens everything together, and so it will help make a very loose diarrhea more solid and kind of slow that down. And that's another great one for kids as well. So addressing that, we talked about turmeric in terms of headaches, so I love that. But also calcium and magnesium, and I like both of those. They're great being paired together, but sometimes I want just one or the other. So for people that are dealing with a bout of constipation, I like to do just the magnesium. But vitamin C is also good for that. I kind of like to have a good stockpile of solo nutrients for really short acute things, like if there's an acute case of constipation, I like to have magnesium for that. In general, I like to have them in a combination product when we're looking at nutritional protocols. What else to go on the stockpile? Turmeric, obviously, we just talked about that for headaches.
I have to add colloidal silver.
Right, colloidal silver is great. It's an amazing antimicrobial agent. You can use it topically. You can use it internally for any sort of skin wound. I love using it as a spray. You can use it as a mouthwash. And then internally, it's great, especially the colloidal silver can break through things like biofilms when you're dealing with GI infections where you're getting lots of bugs working together. That can be quite helpful. I use colloidal silver a lot for things like SIBO, small intestinal bacterial overgrowth, is something that I like to use that for when some of the other antimicrobial agents don't quite cut the mustard, so to speak. So colloidal silver is great. There's so many options. I have such a large home remedy kit at home.
You're gonna have to go home, look at your kit.
Yeah.
Come back here and we'll do a podcast just about everyone's medicine cabinet, which should be in everyone's first aid kit.
Probiotics. I do have my travel kit list of things to travel with. So probiotics, the immune support, right, the echinacea and the elderberry always travel with some golden seal, something with berberine in it. So golden seal or Oregon grape, something that's going to be antibacterial in case I eat something that I need to take care of relatively quickly. Some white willow is good in case there's aches and pains, but also fever. So those are kind of my go-to travel kits, and then some essential oils. I love to travel if you're going anywhere tropical. I always make sure that I travel with tea tree because it's so helpful for putting on those bug bites to help with the itching. So I actually always travel with the Burt's Bees acne stick because it's got the tea tree, it's got some witch hazel, it's got a little bit of alcohol in it too, so it burns when you put it on a bug bite, but that helps with the itching, and it's very drying, and so it dries it up, and then it's got the tea tree in it. It really helps it heal quite quickly. I've definitely been in tropical places and thought, can I get this shipped here? Does Amazon go to Fiji? So.
I love that. And I have to say, I agree with you. I always travel with essential oils. I once had a really bad foot infection from walking barefoot in the woods in Florida. Don't recommend that. And tea tree oil cleared it up just like that.
Yeah.
And then I love traveling with either peppermint or ginger for helping with nausea. Both you can put on a little piece of cloth or napkin and inhale it should someone have car sickness.
Right.
And
yeah.
so or if you have jet lag, peppermint is great, especially for kids, to energize them, wake them up. Or it's helped me not fall asleep while I'm on the road when I'm driving. So absolutely recommend that. Very cool. You know, I was going to ask you, as a naturopath, what do you do when you're about to come down with a cold, or when someone in your family is about to come down with a cold? But I think you answered that. Is there anything else you would add to that if you or someone in your household were beginning to come down with a cold?
I love herbs, and I love nutrition as well. So I high dose things. I'm not afraid to take a lot of herbs to really get it going. And so one of the things I do is I have my elderberry, and also a mushroom extract that I often use a lot. Or also if I've got a nice berberine compound, I'll take a lot of it just every 2 hours. I'm really proactive about it, and that there have been times where I had fever and chills, and I swore the next day I was going to be laid out in bed with influenza. Woke up the next day and I was fine, absolutely fine. So people tend to be a little bit hesitant sometimes with using herbal medicine or nutritional medicine, saying, oh, well, maybe I could take too much. And that's certainly true. There are herbs that are quite dangerous, and most of those aren't going to be available on the market for people to have access to. Most of the herbs that you're going to be able to get short term, there isn't a high risk profile for that. Now, always be careful if you're pregnant. Consult a provider that they're naturopathic midwives that have that training to know what's indicated or not safe for pregnancy. But I high dose things, and it tends to be really effective. If people come in and they say, oh, I tried that sleep formula that you recommended, and I took 1 dropper full before bed and it didn't work. Yeah, I take 2 droppers full every 15 minutes for the next hour. Odds are you're going to be asleep after twice, but go ahead and keep taking it, and we'll get to that point. So it's people don't often think about taking their prescription medicines or combining prescription medicines even when there are known contraindications, because the doctor just told you to do it. And there's such a lower risk profile with herbs and with nutrients. So I really like to take robust doses of things.
What you said about people don't even think twice about combining drugs. I have a very good friend of mine who lives in Las Vegas, and he about 4 years ago started throwing up blood and went to the emergency room. I went to pretty much every hospital twice a month for 4 years. I mean, it was just in and out of hospitals, and they were accusing him of everything from faking it to trying to get pain drugs. And he's like, do I look like, I'm not asking for pain drugs, I'm asking for you to fix this. And they couldn't find anything wrong with him. This is going on for years. And eventually he was in the VA hospital. One of the nurses looked at his scripts and said, oh, you're not supposed to be on these 2 medications. They cause people to vomit blood.
Right.
And it was just maddening that the pharmacist never caught it, because he filled those scripts all the time at the same time, that the computer, there's no
Oh, there
There's
is.
like,
I'll tell you what, there is. On my medical record system, every time I prescribe a drug, if I need to prescribe a drug or if I'm entering drugs that patients have been prescribed, big red warning comes up all the time with drug interactions. And lots of times, I think providers feel like they don't have any other options. Patients are coming in and they're demanding answers. And it's a challenging role to be in. I'm not angry or think that my other medical colleagues are trying to harm people in that happening. It's very limiting to not have a lot of time with patients, which in lots of medical systems you get 7 minutes, next patient. That's what you have to do because that's how the system's working. It's challenging to be able to see a patient that says, I still have this problem. Why can't you fix it? And they're demanding something else. And sometimes doctors will say, okay, well, I'll give you this other thing and this other thing, and then you get the polypharmacy. So I think it's really a lack of options and a desperation in some people's sense to try and get these things under control. And it's just that there isn't that collaboration happening to be able to get better options. What I would like to see in our medical system would be a collaborative care system where, go ahead and see your medical doctor to manage these things. And if they see, okay, we're starting to get worried about your weight, then they refer you to someone else that can spend the time to do the nutritional counseling the way that they'd refer someone who had kidney disease to a nephrologist. This inner referral system, refer to a naturopath if they're not seeing a naturopath for their primary care for these other interventions. And so that's what we do at the clinic that I'm at now, is because we do some primary care and we do some pain management. And so lots of times we act as a natural health specialist for folks, where they come in, they see their medical doctors once a year to get their annual exam stuff, and then they come in to work with us to change those markers later. Now, as a primary care physician, I also think it's very important, and perhaps with your friend, the ball was dropped, because that's the role of a primary care physician, is to look at all these drugs, see what everyone else is doing and prescribing, because the cardiologist isn't always talking to the neurologist, and nor do they care about whether these drugs interact. They say this patient needs this drug. That's the role of the primary care physician, to look at all of it and say, is there something about, they're the coach of the team, and they need to make sure that everyone understands the game plan and to make sure that everyone's working together. And so with your friend, the ball was dropped, whether it was because of a lack of time or but something wrong in the system, and that's why we need to change it so that we're able to work together. Like the example that I talked about with the rheumatologist that I love working with. I love working with my medical professionals that are open to and excited about medical care. Where they come back and they send me letters saying, on your treatment protocol, so-and-so is improving. And actually, one of the recent letters that I received from this particular physician said, I'm questioning my original diagnosis of autoimmune disease based off of the improvement in XYZ symptoms that this patient has gotten under your care. And so I think we can make it better, and we can do it by sharing this information.
Once you described to me how to find a doctor, can you share with the patients? Can you share with our listeners? Because for you as a listener, if you're going through the same frustration that my friend went through, where maybe have been suffering, we tend to sort of put things in our blind spot. So you go about your day, but if there's something that you don't like about your health, and if you consider the definition of health, freedom from symptoms.
Yeah.
And if you're experiencing a symptom and it's chronic, it's a long time you've had these symptoms or these problems, and it's not getting resolved, it might be time to start shopping around for another doctor. So Dr. Megan, can you share with our listeners your guide to doctor dating?
Yeah, so and I think you hit on it. So I think that finding a physician should be like speed dating. If you don't like the person, don't go see that person again. Unless they're the only game in town and you don't have any other options. If you need to see a neurologist and there's no neurologist for 200 miles, tolerate that person, but don't make them your sole care provider. what you need to do, because many people, especially in the United States, we do have many options for care providers. And if you don't like the person, or if you're not getting results, because you're trusting them with your life. Essentially, sometimes it doesn't always feel that way, but I very deeply feel that my patients put a trust in me to be able to screen for things. If they come in, I've had patients say, wow, you do a very thorough exam, because I'm feeling their thyroid, I'm doing an abdominal exam, I'm checking their liver, I'm checking their reflexes, I'm checking their ears and their eyes. And that was instilled in me in my training at Bastyr. I remember one of my supervisors when I was on a clinical shift saying, doing this 7-minute, 25-point exam is going to catch so many things. She said, I've caught cancer with this, and a patient didn't know that they had it. There's a lot of things that by just doing simple exam that you can catch, and making sure that regular blood work is done, appropriate screenings are done, checking in on a patient, talking to them, asking questions, when you're seeing them for a yearly exam, and seeing if they're depressed. There's a lot of things, screening things that you can intervene in early, and as a primary care physician, that's my role, is to help people stay healthy, and if they're dealing with illness, help them optimize their health and return to good health. So you need to like that person, and you need to trust them, because you're trusting them with your life. And if you don't like them, I'm my patient's employee. Now, some doctors don't like that idea. There's certainly probably many patients have had this experience where they feel like they're dealing with the doctor God, right? They're on a high pedestal, and they're telling you what you need to do. And if you don't do it, then you're fired. Well, I think it's the other way around. You decide. You're in charge. And all of the medical care providers that you can go see, whether it's a naturopath or a medical doctor or a specialist, or it's a nutritionist or an herbalist, or it's your massage therapist, or whoever you're going to see, we're all different tools in your toolbox, and we all have a different skill set. I practice differently than other naturopaths. I practice differently than the other naturopaths in my clinic. And we all have different things that work well for us, and different assessment tools. And it's about finding a match that works well for you. And so one of my mentors I saw him give this explanation to a patient who came in sheepishly, who hadn't come in for a couple of years. And the patient said, well, I kind of hesitated in coming back because I stopped seeing you for a while, and I didn't want you to be upset with me. And he said, look, I am not going to be offended. I am a tool in your toolbox. When you have something that you need addressed, you come in and you pick up that tool and you use it because it's the appropriate tool for the appropriate problem. And if you want to try a different tool, or if there's another issue that needs to be addressed, I'm not going to be offended, because it's your life. You're the one who's in charge. And that's how I meet my patients, is we're working together collaboratively. And yeah, I have a certain set of knowledge that I'm an expert in, but they're an expert in their body. We're two experts coming together to meet to work towards a common goal, and they're the ones steering the ship. Now, sometimes they ask me to steer the ship, and I'll do that, but they're actually still steering the ship. They're the one who decided that they want me to tell them what to do.
And at the end of the day, then they have to take what you tell them to do and go do it.
Right.
A patient has to then follow through
Yeah.
with your advice.
Yeah.
So the patient's always in charge. And if you don't feel in charge, then maybe, you should find another doctor, and also get that you need to be in charge.
Right.
Because it's at the end of the day, your doctor's not going to come home with you and cook for you and hand you your supplements and go for a jog with you.
Yeah, they're not going to meditate for you.
I wonder, how much could I pay you to meditate for me? And
I would love to be paid to meditate. Let's start. That sounds great.
well, speaking of which, I have one last question for you, and that is, you're stranded on a tropical deserted island, and yeah, you can bring your family with you, because I'm not going to leave you alone out there, but you can only bring 3 things from a supplement store. What would they be and why?
3 things from a supplement store. Well, I'd want something that was a strong antimicrobial agent that I could use topically and internally for any sort of infections, because maybe we're on a tropical island. I'd like to be on a tropical island because I like to have a good tan. So we'll call it a tropical island. I'd probably want something with either berberine or colloidal silver in it. Maybe the colloidal silver, maybe the berberine, because it has some good liver properties as well. That's very challenging. So 1 antimicrobial agent. Do they sell water filters at the store? Can I buy some? At how much chocolate can I buy at the health food store? Because I can get fish, I can harvest herbs. What I want is, let's see.
A lifetime supply of chocolate.
Yeah, I want a lifetime supply of raw cacao. This is a very challenging question. I think I'd go with I'd want a good multivitamin because I'm going to be on an island. So I want a good multivitamin with all my trace minerals, everything in it, because I'm not going to be able to forage everything that I need. So, something like maybe the Longevity, the Beyond Tangy Tangerine, something like that would be great. I want my antimicrobial agent, so probably the colloidal silver. And there's an herb, it's called Pisidium, and it's used as a muscle relaxant, but it's also used as a neurotoxin to kill fish in parts of the tropics, and the fish kind of float up, and that's how you go hunting. I might want that as my survival technique. Let's say there's a pond on the island and I can use it to hunt for my fish.
So you put the herb in the pond and all the fish just
I
float
don't
to
know.
the surface?
I guess I'd want some indigenous training on how to use the herb that way. I know how to use it for cramp relief formulas. But I do want that survival gear. I guess I'd go for my colloidal silver, my multivitamin with all of the trace minerals, and the berberine too. I want all the antimicrobial agents that I can get.
Well, now, wait, tell me more about this herb. Can we take it if we have muscle spasms?
It's a low dose herb. So it's not something that I recommend using unless you have advanced knowledge of herbal medicine or you're working with a provider. But in a combination formula, it's very helpful. I use it in tinctures for things like severe menstrual cramping or muscle pain. It can be quite helpful for that in a combination product. So
now, just to if someone's having muscle cramps, there's an underlying issue that needs to be addressed.
Yeah.
So it's not like
it's
you take it.
Yeah, it's not an answer to the underlying cause, but it's a get me through while I'm working on the rest of it.
Right. Like if I throw out my back and I have muscle spasms, instead of taking a pharmaceutical, could I take this?
Right. Yeah, like what we were talking about, instead of taking the NSAID.
And what's it called again?
Pisidium.
Oh my God, I'm adding that to my medicine cabinet.
Yeah. It's well, cautiously.
Okay, cautiously.
We'll talk about dosing. Yeah,
Okay.
that is a low dose herb.
Low dose.
Yeah.
Well, cool. I didn't even know that there was a herb that did that. That's really neat.
All right, I'm changing it from that one to a full homeopathic remedy kit. Fully stocked with the most common 100 remedies.
I love that. And not a lot of people know about homeopathy, so I have a feeling we have to have you back on the show to talk about homeopathy, because it actually works. When I was pregnant, my first trimester, I had the worst. It's not morning sickness. It's all day and all night sickness. I had a migraine constantly. I was so dizzy. I thought I was going to fall over. I was nauseous like crazy. I had hot flashes, and the room was spinning, and just being in the car, the motion of the car made me just want to split in two. It was wretched. And then I was told to take a homeopathic, and all my symptoms cut down by 90% within 10 minutes. And it was completely tolerable. And homeopathy was the only thing that got me through my first trimester. And then after our baby was born, we've been using homeopathy for his teething, and it works almost instantaneously. He's crying, he's teething, his gums are bleeding. I mean, these teeth are popping through. And we pop these little homeopathics into his mouth, and all the pain melts away from his face, and he stops crying. And some people say, "Oh, homeopathy, that's just that's just the mind. Your mind is thinking it's going to work, and so it works." But my counter to that is, then how does an 8-month-old?
Right. It's not placebo effect with the baby.
Right. And I didn't even think that the homeopathy would work when I was in my first trimester, so I was pleasantly surprised. So it couldn't have been a placebo effect then. So we'll have to have you back on the show to talk to us about homeopathy and how we can use it in our life for our health. Thank you so much for coming on the show today, Dr. Megan Saunders.
Yeah, thank you for having me.
Looking for even more ways to feel and look healthy? Come to learntruehealth.com and get our free healthy cookbook. There are some delicious recipes and they're super healthy for you. All you have to do is visit learntruehealth.com.